Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Hello, listeners. Welcome to Business Innovators Radio. This is your host, Constant Taylor. Today, we have a very special guest on the show, and they're going to share some very exciting information with us. So, if you're looking to learn more about healthcare, then you've come to the right place. Our special guest today is Kurt Kazanowski. Kurt has been speaking professionally for over 5 years, and the primary content that he speaks on is healthcare. He speaks for healthcare associations, adult care, and caregiving. He has spoken both nationally and internationally, and he's based out of Metro Detroit. His latest book is called A Son's Journey, Taking Care of Mom, and he's also got an eBook out called The 7 Pillars of Growth. Kurt, welcome to the show.
Thank you. Hello, how are you?
Hey, I'm doing great. Thanks for taking
Excellent.
time out of your schedule to
My pleasure.
come and speak with us. Now, I'd like to kick off the show by asking you if you could tell the listeners a little bit about your business and how you help individuals or organizations become more effective in the areas of healthcare.
Sure. Well, I have two specific businesses. One is more of a personal care company called HomeWatch Caregivers, and we provide caregivers that go into people's homes and help people stay safe, secure, and independent. And obviously, with the tsunami of aging that's occurring nowadays, there's a lot of demand for that. And then I work through Hospice Advisors in terms of working with home care and hospice companies, just really better understand how to provide quality care, develop programs, like I said there again, to meet the needs of the aging population.
Okay. And how did you, taking a step back for a second, what's your background and how did you come to consult and speak in the healthcare industry?
Sure. Well, I'm a nurse by trade. I went to University College of Detroit and practiced as a public health nurse for many years, and then went back and got my master's degrees and started dancing there and worked in the Mercy Trinity Health System, which is the largest Catholic healthcare system in the country, and worked in the acute care setting. And then in '99, transitioned and went into working in home care and hospice. And 8 years ago, I ended up starting HomeWatch Caregivers, a personal care company I mentioned, and at the same time, Hospice Advisors. So that's just a quick sort of backdrop on me. And I also, as we chatted a little bit before the show, I actually have a part ownership of a home care company in Moscow, Russia. So, the issues of aging are international, it's just not here in the United States.
And how did that collaboration or joint venture come about?
Well, to be quite honest, it involved a very beautiful Russian woman.
Okay. Okay.
I was actually dating at the time, and she ran a bank. Long and short of it, one of her clients was a large medical development company in Moscow. One thing led to another, and I met the CEO, and we hit it off, and that was sort of the beginning of us looking at the needs of the Russian population as aging occurred there, and that was the foundation for starting First Home Care, which is the home care company in Moscow.
Okay, excellent. Now, what are some of the problems that the organizations that you deal with face, and how do you help them work through those issues?
Well, I think you're right. In fact, as we speak, I think I'm over in Chicago working with a hospital system that really helping them understand how to better utilize the resources of hospice and home care to meet the challenges of all the people that they have that come into their hospital that have end-of-life care issues or issues just staying safe, secure, and at home. And it's really a lot of education and awareness and working in a collaborative fashion to have the hospital staff and the folks that run hospice and home care better understand how they can work together as a team. Because, healthcare in the United States, unfortunately, is still too fragmented and disjointed. And unfortunately, when that occurs, it's the patients and families that fall between the cracks. So I work to help to try to prevent that.
Okay. What are some of the common misconceptions about what you bring to the table, and how do you dispel those?
Probably the most underutilized, misunderstood resource relative to end-of-life care and aging is hospice. And people have a real misconception that it's just for folks that are immediately dying. when in fact the hospice benefit was constructed for people that are having challenges with their health to provide a service for 6 months or longer if they need eligibility. And there again, the misconception is when people sign on to hospice, they think that they're going to die. And that's not always necessarily a fact. People will get the care and attention they need. People will be actually discharged from hospice because they've gotten better and things have improved, and they're discharged, and they may end up coming back on hospice, but it's not necessarily like the grim reaper kiss of death that people think it is. So again, that's one of the big misunderstood things about hospice, is that it can be a wonderful resource for folks.
Well, I'm glad that you shared that with myself and the listeners, because that's definitely a perception that I have from personal experience and interacting with the people there. I mean, I've even heard them say, our job is to make them feel comfortable, during their last few whatever months on Earth. Is this something that you educate both? Is this something that you educate the organizations on as well as individuals?
Sure. The Hospice on that right today is, we're talking specifically about that. You're right, is, hospice is palliative care. In other words, it's comfort care. But a person can come on to hospice, and with the right palliative care doctor providing oversight and adjusting their medication and providing care, some folks actually rebound, like I said, to the point that they no longer meet eligibility and sometimes will be discharged from hospice. So like I said, it's not always, like I said, the picture that people paint that it's only for people that are actively dying that you can be admitted to hospice. You can have a life-threatening illness and a challenge in front of you, and if you meet criteria, you can access your hospice benefit, which provides you with an array of resources that people are not even aware of that help them through that period. Now, there again, unfortunately, they may end up going down that path in their disease trajectory takes them to the point where they do pass away. And there are folks that will bounce back, and like I said, to the point that they no longer meet eligibility and are discharged. So I'm just saying is that it's a very misunderstood resource.
Okay. What are 2 or 3 problems, either real or perceived, that you help your customers, clients solve?
Yeah, yes, I think the big thing today is if you and I were brothers and mom was at home and mom wanted to stay at home, we'd have to go through a process of identifying some assistance for her. And the big thing is how do you make sure you're getting the right resource from mom? And there's a couple things I'd like to just share with the listeners. One is they need to make sure that the agency there, again, people will say, well, God, going to an agency is so expensive, I can advertise on Craigslist and get somebody for half the cost. And I go, yes, you can, but you never know what you're getting. And some of the basic questions your listeners should understand is that they're looking for a caregiver, that they need to make sure that that caregiver has a national criminal background check done upon the time of hiring and moving forward every 6 months, that their DMV records are reviewed. You need to ask the caregiving agency, tell me about your quality assurance program. In other words, do you have people that are out in the field that will just pop in and check on the caregiver that's with my mother on a spontaneous basis? And are they licensed, bonded, and insured? So those are just a few basic questions your listeners that are considering hiring a caregiver is to make sure that they ask.
Okay, excellent. Now, in terms of, Obamacare has changed the way many organizations and individuals manage and interface with healthcare. How has that affected your business, if at all?
Well, if anything, on the personal care side, it has really put a lot more of the responsibility for personal care on the family. Right now, there's 4 ways that personal care. There's 2 types of, just really quick, there's 2 types of home care. There's skilled home care. You break a hip, you go in the hospital, you come home, you get rehab, and the agency will come out with a nurse or physical therapist for like 4 to 6 weeks, and that's reimbursed by insurance. Then there's personal care, home watch caregivers, and there's 4 ways that's paid for. The kids get together and they slap it on a credit card, and they pay for it privately. If the client or the surviving spouse of the client is a VA, a veteran, there's a little-known benefit called paid in attendance that will help pay for personal care. Thirdly is if you have a long-term care insurance policy, that insurance company may work with you to help pay for in-home care. And then the last time, I have a couple clients right now doing this, is they want mom and dad to stay at home comfortable. They promise mom and dad they never will put them in a senior living community, and they're doing a reverse mortgage on the home. Those are the four primary ways that personal care is paid for.
Okay. Now, in terms of actually client acquisition, what are some of the main hesitancies that prospects have with making a decision on using your services, and how do you help them work through those issues?
Well, it's a lot of times, it's usually the adult kids. If you and I were brothers, we see that mom needs care.
Mm-hmm.
It's mom who says, "I don't need this. What are you talking about?"
Right.
And it's sitting down and going through a process with mom to have her understand that we want to keep her at home safe, secure, and independent, and that we want to have. And I'm getting away from using the term when I talk with clients, especially the actual people at the scene. It's not a caregiver; it's a personal assistant. That person comes in and helps them, with the activities of daily living, some meal preparation. We'll help out with some personal care if they need assistance showering or bathing, running errands, medication reminders, light housekeeping. And I think once the user, usually it's like if it was our mother, is once that person comes in and they see the value, they're pretty well won over. So the issue isn't so much the adult kids. The challenge with the adult kids, as I mentioned earlier, is picking the right agency and making sure quality's there, making sure you have a good match, making sure that you're keeping tabs. Because there are horror stories out there. There are just horror stories, unfortunately, in our industry of even legitimate agencies that just don't keep an eye on their caregivers, and their caregivers will do stupid stuff, and that's sort of scary. But that's one of the things that Home Watch is very strong on all of the Home Watch operations around the country, is that commitment to higher level of quality and security. So again, it's the adult kids usually get it. For them, it's selecting the right agency. And then, like I said, with mom, it's just getting mom to give it a chance.
Now, with your second book, your eBook, The 7 Pillars of Growth, what's covered in that briefly? Well,
it's focused primarily on healthcare-related organizations, and it really talks about how do you go about developing healthy growth. Because everybody wants to grow. Everybody wants, I want to grow. I want to do this. A lot of folks and organizations don't do what is necessary to grow. And this book talks about what are those necessary things, those 7 pillars. And just to give you an example, the first pillar is creating a culture of growth. And I consider that the glue that holds the other pillars together, because if you don't have a common mental model in your organization about service, about customer loyalty, etc., you're going to have a hard time growing and retaining those people that look to your organization for services. So the book really talks to and gives specific examples and tools and techniques on how to grow their business and do it in a healthy, sustainable fashion.
Okay. Now, with the last minute that we have here, I'd like for you to, if you could, convey one concept, theme, or thought that you would like to leave the listeners with, so that if they don't get anything else out of this interview, this is what I want to leave them with.
Okay. I think it would be is, as we all look at our future, is to take the present, being now, staying in the now, to look at what you want to do for yourself as you prepare for your aging. Because nobody likes aging is a bummer. Who wants to talk about aging? But look at, what are the things that you can do to make your future years and your folks' future years, rich and prosperous and safe and secure. So my big wish for all the people listening is to embrace looking at your future, but to use the present and now to plan for it. Because there again, planning, hope is not planning. You can sit down and do some specific things. Just being able to, like I said, even listen to this interview and even have some thoughts rolling around your head is a step in the right direction. So I applaud you for giving me the great opportunity to come on board and talk.
And this is definitely a unique niche that you're involved in. I mean, it's a huge industry, but the specific niche is definitely one that's needed. So if the listeners would like to learn more information about your services, and if they would like to get in touch with you, how can they do that?
Sure, I'd be more than happy to give both my personal email and my telephone number. My cell number, I'd be more than comfortable to do that. My email is, www.kaznow, K-A-Z, as in zebra, N-O-W, at Comcast.net, so Kaznow at Comcast.net. And my cell number is 734-658-6162, whatever I can do, both from an individual perspective. If there's somebody out there that's working in a healthcare organization who will want to explore some of these concepts and ideas further, we'd be more than happy to be able to assist them or point them in the right direction.
Okay, fantastic. Kurt, thank you so much for coming on the show. That was very
fascinating.
Thank you.
I appreciate the opportunity.
Not a problem. I appreciate it, and I know that the listeners do as well.
Thank you.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.